Hi, I'm Dr. Sachin Patel. I'm a urologist here at UroPartners. I underwent a 2-year fellowship training at Madison, Wisconsin in endourology, which is stones, as well as minimally invasive surgery, which includes robotics as well as laparoscopy. So one of the common procedures that we use to treat stones is ureteroscopy with laser lithotripsy. What that procedure entails is, with the patient asleep, no cuts are made. We'll usually enter the bladder through the urethra and then place a wire, which is called a guide or a safety wire, up the ureter, which is the tube that connects the kidney to the bladder. We'll then use a very small scope, and we have either flexible or rigid scopes to go alongside the wire to where the stone is located. Now, depending on the size of the stone, we may be able to grab the stone with a very small basket and remove the stone. Or in some cases, when the stone is larger and impacted or stuck against the ureteral wall, we use a very small laser to fragment and break that stone into smaller pieces so that the pieces can either be washed out or extracted. At the end of the procedure, a decision is made by the urologist as to whether to leave a stent. A stent is a tube that connects the kidney to the bladder, usually traversing the area that has a lot of edema. The purpose of the stent is to allow that edema to decrease so that later the stent can be removed, leaving the ureter intact. So shockwave lithotripsy is a technique that can also be used for patients that have an obstructing stone or a stone in the kidney. Shockwave lithotripsy has come a long way since its inception, and it is a non-invasive way of breaking stones without any manipulation of the ureter. A patient that undergoes shockwave lithotripsy usually has the procedure performed as an outpatient. The patient is put to sleep, and the stone is then targeted using fluoroscopy. Once the stone is targeted, shock waves are generated via the lithotripsy machine and are focused, just like they would be for two foci in an ellipse, at the stone. The convergence of those shock waves at the stone are what lead to breakage of the stone, and many times the stone can be broken into dust. One has to be careful though, as very hard stones sometimes cannot be fully fragmented with shockwave lithotripsy. At the end of the procedure, fluoroscopy is again used to visualize the stone to see that it has been broken. The patient is then awoken, and then with hydration, the patient is then allowed to pass the fragments over a period of time.